What is the most common complication during ECMO in neonates and pediatric patients? A. Cannula dislodgement. B. Circuit infection. C. Organ bleeding. D. Air embolism. Answer: A. Cannula dislodgement. Explanation: in neonates and pediatric patients, the most common complication of ECMO is cannula dislodgement, which can occur because of the small vessel size and movement of the patient. It is essential to secure the cannula properly and closely monitor its position to avoid this issue. When weaning a patient off ECMO, which of the following is critical to assess first? A. Blood pressure response. B. Oxygen saturation levels. C. Cardiac output and function. D. Hemoglobin levels. Answer: C. Cardiac output and function. Explanation: when weaning a patient off ECMO, it is critical to assess the cardiac output and function first. If the heart can support normal circulation without ECMO support, the weaning process can proceed. If cardiac function is still insufficient, the patient may need continued support. Which of the following patients is most likely to benefit from ECMO therapy? A. A patient with severe chronic obstructive pulmonary disease, COPD. B. A patient with a history of irreversible brain damage. C. A patient with acute respiratory failure due to influenza. D. A patient with end-stage cancer. Answer: C. A patient with acute respiratory failure due to influenza. Explanation: ECMO therapy is most beneficial in patients with reversible conditions such as acute respiratory failure due to influenza or severe viral pneumonia. In contrast, patients with chronic conditions like end-stage COPD or irreversible brain damage are less likely to benefit from ECMO therapy. What is one potential long-term effect on patients who survive ECMO therapy? A. Permanent liver failure. B. Chronic respiratory failure. C. Neurological impairments due to ischemia. D. Complete restoration of cardiac and pulmonary function. Answer: C. Neurological impairments due to ischemia. Explanation: one potential long-term effect on ECMO survivors is neurological impairments caused by ischemia, often due to reduced perfusion or complications during ECMO support, such as stroke or brain hypoxia. Cognitive deficits and motor impairments are possible, particularly if there was poor cerebral perfusion during the critical period. What does the term oxygenator refer to in ECMO? A. The pump that circulates blood through the system. B. The component that removes carbon dioxide and adds oxygen to the blood. C. The filter that removes waste products from the blood. D. The cannula that delivers oxygenated blood to the patient. Answer: B. The component that removes carbon dioxide and adds oxygen to the blood. Explanation: the oxygenator is the component of the ECMO circuit responsible for gas exchange, which involves removing carbon dioxide from the blood and adding oxygen. It functions similarly to the lungs, allowing for oxygenation of the blood in patients with severe respiratory or cardiac failure. What is the most important factor in determining whether a patient should receive ECMO therapy? A. The patient's age. B. The reversibility of the underlying condition. C. The availability of ECMO equipment. D. The level of consciousness of the patient. Answer: B. The reversibility of the underlying condition. Explanation: the most important factor in determining whether a patient should receive ECMO therapy is the reversibility of the underlying condition. ECMO is most effective in patients with reversible conditions, such as acute respiratory distress syndrome, ARDS, or cardiogenic shock, where the heart or lungs can recover with support. Which of the following is a major risk factor for developing complications during ECMO therapy? A. Prolonged mechanical ventilation. B. High flow rates in the ECMO circuit. C. Inadequate anticoagulation. D. Low ECMO blood flow rates. Answer: C. Inadequate anticoagulation. Explanation: inadequate anticoagulation is a major risk factor for developing complications during ECMO therapy. It can lead to clot formation in the ECMO circuit, resulting in thrombosis, embolism, or mechanical failure. Conversely, excessive anticoagulation increases the risk of bleeding complications. Which of the following ECMO configurations is typically used for respiratory failure without cardiac involvement? A. Veno-venous, VV, ECMO. B. Veno-arterial, VA, ECMO. C. Central ECMO. D. Veno-caval ECMO. Answer: A. Veno-venous, VV, ECMO. Explanation: Veno-venous, VV, ECMO is used for respiratory failure when the heart is functioning normally. It bypasses the lungs to facilitate oxygenation and carbon dioxide removal but does not support cardiac function. This is ideal for conditions like ARDS, acute respiratory distress syndrome, or severe pneumonia. Which of the following is typically used as the first-line anticoagulant for patients on ECMO? A. Heparin. B. Warfarin. C. Aspirin. D. Clopidogrel. Answer: A. Heparin. Explanation: Heparin is the first-line anticoagulant used in ECMO therapy. It is used to prevent clot formation in the ECMO circuit, ensuring the blood can flow freely and minimizing the risk of thromboembolic events. Regular monitoring of activated partial thromboplastin time (APTT) is essential to maintain therapeutic anticoagulation. What is a potential complication of ECMO therapy related to the mechanical pump? A. Increased risk of hypoglycemia. B. Shear stress and hemolysis. C. Pulmonary edema. D. Hypertension. Answer: B. Shear stress and hemolysis. Explanation: A potential complication related to the mechanical pump during ECMO therapy is shear stress, which can lead to hemolysis, destruction of red blood cells. This can occur when blood is subjected to high velocity or turbulence as it moves through the pump, causing damage to red blood cells and resulting in anemia or other complications.